Okay, Brad and I have worked with thousands of knee replacement patients over the years, and I have found that they tend to make three big mistakes. We're going to talk to you about those.
And one of them is not getting the knee replacement.
Bob and Brad, the two most famous physical therapists on the internet.
Okay, this first mistake, Brad, actually my mother-in-law did.
Mm-hmm.
She went from the walker to the cane and then to no cane too rapidly.
Sure.
And her knee got flared up and she lost motion.
Ah,
So,
I'm assuming increased pain with it.
right.
Mm-hmm.
So we really want you to be careful in transitioning.
Right.
So,
So oftentimes you'll be with a therapist and they'll help
right.
and guide you, and you say, "Am I ready to go?" And they'll do some balance
I
testing.
would err on the side of staying with longer.
Right.
Yeah.
Yep. Yep. Be
And then
safe.
try it for 15 minutes and see how it is the next day.
Sure.
But
Sure.
don't make the knee worse.
And of course, it's quite a jump from the cane or walker to the cane. Of course, even a
Right.
bigger jump to the cane
Nothing at all.
without anything. So,
Right.
yeah, it's a good thing to be cautious with. Okay, Bob, just before we get going on the three mistakes, we want to let people know that the vast majority of knee replacements go very well.
Yes.
I would say at least 95%.
Yes, I've seen that. It's sad.
Yeah, and so we're going through the mistakes. Just it's going to help you through it. It's not to scare anyone.
Right.
Just to
Good
make
point, Brad.
your positive experience more positive.
All right. The second mistake people make is they are given a whole load of exercises and they don't know where to focus. But I tell them to focus on bending the knee
Yep.
and straightening the knee. It's going to get strong. So I'm not worried about that, but I am worried about you might be lacking the straightening
Yep.
or you might be lacking the bending.
Yeah.
So
Particularly
those are the things you want to focus a little laser on them.
Right. The first week or two is really important, and that's why we're showing it in bed, where
Yeah.
sometimes it's easiest to start here because that's
So
where
we're
you are.
using the knee glide here because we think it works really well, and Brad's going to show flexion on.
All right. So the idea is you can do it on your bed. You can put something on your bed so that your
Like
heel doesn't.
a cookie sheet.
Yeah, anything to reduce the friction, because that really, it's just you can't do it like that. You need something to allow it to go freely. And I've got a belt here or a strap, and what I'm going to do is you can just put it around your shin. It kind of works nice if it's long enough to
Right.
make
Wrap
a
around once.
Yep.
Around your foot.
and then you can pull, and that's one thing with a knee replacement. When you're bending it or straightening, that is one time pain is okay.
Yes.
You got to break up that scar tissue.
And
Wow.
I think it helps when you're in control.
Right.
mean-
As opposed to I've pushed.
If I'm pushing, they don't let me go as far if they do it.
Yeah, you just cannot relax when someone else is inflicting pain on you.
Right.
Well, it's pretty true. It's a direct way
And
to
if
say
you
it.
do it, there's something I'm worried about you a little bit.
Yep. So again, we're going to bend it as far as you can, stretch it, ow, and then let it go back down. And that that's the way I like it. Some therapists will say you got to hold it and stretch it in pain for 30 seconds. I've always had good luck going
Right.
pressure on, pressure
Yep,
off.
exactly.
Yep.
Now, Brad, we can roll this towel up and actually do extension right here too.
So in other words, getting the knee straight.
Right.
And a lot of people think just bending the knee is important, which it is, but getting it straight is equally or sometimes more important,
Yes.
especially for
Why don't you put
walking.
your heel right on there and
Yep.
show a little bit of a bend,
Yeah.
Brad.
So let's say I can't get any farther than that. So Bob rolled up the towel, put it under my ankle, and there's an air gap. And just sometimes relaxing and letting gravity pull the knee down is
You
enough.
could sit up on this one too,
Yep.
Brad, if you
Yep.
want.
Yeah, if you have a bed that goes up or you're comfortable sitting
Put
up.
a little more stretch on the hamstring.
Yeah, and then I'm gonna actually put a little pressure above the kneecap. Because you're gonna have an incision here. You got to be careful and mindful of that, particularly early on. And stretch, stretch, stretch. This
And
works good to put the
if you
cold
don't-
pack on
If
there.
you don't have the knee glide, you can put this on the bed itself.
Yes, just a towel roll,
Yep.
any kind of a comfortable cushion that creates the gap,
Right.
and then
Yep.
Put that pressure down.
All right, Brad. When you're also going to be doing these same exercises in a seated position.
So what we need is a slippery surface. So you can have
Right.
a shiny floor with a sock on, and you can start to do motion like this.
A lot of people do floor scrubs.
Yep.
They're
Yeah.
on a tile floor to put the towel down and
Yep.
they'll slide back and forth.
If you're on carpet, you can use this. Actually, was good a plastic clipboard,
Or a cookie sheet.
cookie sheet, anything to make it slippery, and you know
Right.
that'll work. But we find that works actually the best.
Is the knee glide.
Yep, a knee glide again, and that's it's made for it, and that's why it works well. Very little friction. You can use your other foot to help push.
That's where it really pays off, I
Yeah.
think, Brad.
And then the unique thing about this is you can change the angle, and that's one thing you cannot do with the towel or the.
Right. This is going to be a lot more comfortable on your ankle, and it's going to give a little more resistance to the quadricep.
Yep. And then we can, so you're going downhill here, and as you get better and your range of motion is better, it's oftentimes helpful to strengthen that quad. which you
And
go-
strengthen the hamstring.
Yeah, that's what I
Yeah.
meant. Yep. I'm sorry, Bob. I'm glad you're here because I was getting my muscles flip flopped. My whole head gets flip flopped sometimes. You should see me at home. I'm walking backwards
I'd
down the
rather
steps.
not.
Yeah, my wife
All
has
right.
to.
All right, the third piece of advice I like to give to my patients, Brad, is don't listen to other people, especially other
Especially the
patients.
therapist.
Yeah, especially
Just kidding.
other therapists. But everybody has a Mildred in their life, right?
Mildred.
Yeah.
Who the hell? Who's Mildred?
Mildred is always a lady and knows a lot more than you.
Ah, yes.
And she's going to say, well, my knee got better in 2 weeks or whatever. And first off, that's not true. I mean, it probably took a month or 2 months.
Yeah, but she remembers it that way.
Right.
I mean, some people do really excel fast, but it really doesn't matter because
Exactly. It's just going to throw you off.
Yeah.
I mean, if you have 2 knees done, one is going to be way different than the other.
Mm-hmm.
So it's always different. You can't predict how it's going to go. And it's going to end up good,
Yep.
but just give it time.
Yep. Some people get to walking without their cane or their walker within 3 weeks. Others will take 4, 5, or 6 weeks, and they all end up in the same place in 3 months.
Right. They're all happy.
Absolutely.
And get rid of the Mildred in your life.
The Mildred or the. We shouldn't pick on
Not
female
Mildred.
names because I was going to say negative Nancy, but
Right.
we're going to get hollered at if we have to negative
How about Elmer?
Norbert.
Elmer?
Elmer? Yeah. No, it has to be an N. Negative
Norbert?
Norbert. Yeah.
Okay.
So really, it's important to stay positive with your rehab.